All right, so good morning, everyone. Welcome to our concussion conference. This is being put on by Hoʻoikaika Kino Foundation in collaboration with Kino Physical Therapy with a guest speaker, Dr. Harmeling from Aloha Nui Family Practice.
Good morning, everyone.
And our primary presenter is going to be Miss Kylie Corpus. Okay. So we're going to turn it over to Miss Kylie.
Hi, so like Malia mentioned, my name is Kylie and I am a student intern here at Kino Physical Therapy. And I am currently an undergraduate senior at Pacific University, interested in pursuing physical therapy as my career. And yeah, I'll be your main presenter today. So the Hoʻoikaika Kino Foundation strives to work collaboratively with Kino Physical Therapy to provide access to rehab services for our Hawaii community. Our goal is to allow student interns like myself to gain experience through treating patients who are unable to access rehab services. We also hope to open up a community-centered athletic training room that will allow athletic training services to be provided to athletes of all ages, not just high school and collegiate.
Yeah, so what we are going to be doing is the student athletes or student interns will be working on patients that we can prove that they have not been able to access rehab services. So the board of directors for the foundation will host an open application process when we know a student will be coming. And that's stuff that we can all look for in the future. As well as we hope that all the proceeds generated from the events that we're doing will help us work towards opening our community-centered athletic training room. And so keep an eye out.
So through this presentation, we will cover statistics on how concussions affect our kupuna, concussion basics, a case study to get a better understanding of what a concussion can look like, and lastly, go over what post-concussion care is. So first, we'll look at some statistics. So 80% of brain injuries in individuals 65 and over occur due to falls. And 1 in 4 Americans over the age of 65 have reported a fall each year. And of those, there is a 26% increased chance of an individual to get dementia following a brain injury.
So Dr. Harmeling, you also work at Legacy, right?
Yes, the rehab facility, skilled nursing facility. Yes, ma'am.
Yes. So how many of the patients that you see there are from falls?
Well, a vast majority of the clients who come in are a result of falls. They either have a fall and they break their hip, or they have a fall and they have a TBI or a traumatic brain injury. Sometimes that injury is very mild. Sometimes that injury is very significant, in which they have sort of like a hemorrhagic stroke and it's very severe for their health. When we think about the elderly, falls are actually relatively common. We know that 65% of all of our elderly have chronic conditions. So this is diabetes, your high blood pressure, your COPD, conditions that affect their overall health and their daily functioning. We know that 22% of our elderly actually have functional limitations. So these are folks who maybe can't ambulate as well. Their vision isn't as well. Their hearing isn't as well. So you can see in an older population that has more chronic conditions, more functional limitations, how they end up having more falls higher than the regular population. And unfortunately, and I'm sure Kylie will go into it, with those falls, sometimes they tend to have more significant, severe, and long-term consequences as a result.
So, and in physical therapy, we see patients who come in, and most times we don't get them for the concussion or the fall itself. We get them, like Dr. Harmeling is saying, like from, the broken hip or, a TBI. And most times what we see is that, patients and their families, is most of the families are complaining about how difficult it is to work with, that patient or their family member. And so when we start getting into the nit and grit of it after an evaluation, we realize that the change in personality, the change in the person is really from the concussion that they experienced from the fall. Okay. And so these are big
Absolutely.
things, that we're going to be talking about. Yeah.
Yeah. And unfortunately, for many times, the family may not see the fall occur. They simply see the elderly folks afterwards, they see the bruise, or even when you see the fall and you see the event, because it happens so quickly, you may not always recognize that they had some sort of head trauma that happens. And also, most importantly, is you don't always have to have a physical strike to your head. Sometimes just the rapid movement of your head in the process of falling is enough to cause a concussion and cause those sort of long-term brain changes, particularly when we're older.
Yeah. Yep.
Okay. So now we'll just get a little bit into more of what a concussion is. So a concussion is a traumatic brain injury. And this is often caused, like mentioned, a bump, a blow, or even a jolt to the head. So this trauma experienced and that impact, it leads to a change in normal brain function. And a concussion comes in two phases. The first being the excitatory phase. This is where the typical concussion symptoms are experienced, like fatigue, loss of consciousness, and headaches. Whereas the second phase is the spreading depression phase, and this is where there's a decrease in brain chemical production, and the change in personality or mood can be experienced. There are also three different types of concussions. The first being a mild one, which has symptoms that last less than 15 minutes and you don't lose consciousness. The second is moderate. Again, no consciousness is lost, but the symptoms do last longer than 15 minutes. And lastly, a grade 3, which is a severe concussion, and consciousness is lost, even if it is just for a few seconds.
And what Kylie brings up is very, very important. She did an excellent job with it. And it talks about the concussion, especially the spreading of depression and other symptoms post-concussion. Oftentimes within the first 24 to 72 hours, the person may seem fine. They may seem absolutely normal. And the grade of concussion doesn't always equal the severity of the symptoms. So someone may have a concussion in which they lose consciousness, but they have very few symptoms, short-term and long-term. Where you may have someone else who does not lose consciousness. They may initially be okay, but then long-term, after 72 hours or so, you may start to see those changes, because those are the natural changes that happen whenever you have brain injury.
Yep. So just mentioned, there's a lot of symptoms that come with a concussion, and they may not appear right away or may not even present very strongly. So you can have a headache, a loss of memory, ringing in the ears, feel nauseous, or you can even just feel more clumsy or be slow to answer. And then again, those changes in mood, behavior, and personality. So a concussion can take 6 different pathways. We're gonna go through all 6. So the first is the vision pathway. Through this path, eye movement is very greatly affected. So this can cause trouble with reading or even looking at devices. The second is body movement and position. Our vestibular system allows our brain to process and detect where our body is in space. And when it's disrupted, we can have a decrease in hand-eye coordination or balance and vision, everything like that can be off.
And one of the big things is, a lot of times, the vision and our vestibular system is when people think, oh, I'm dizzy all the time, or I lost my balance, and they forget that maybe they lost their balance and they accidentally bumped their head and it was fine, no big deal, right? And all of a sudden later, that patient is now complaining of, I'm dizzy when I get out of bed. And they're like, oh, I don't know how it happened. It just happened on its own. And this is where physical therapy comes in. You are experiencing dizziness, you're not quite sure. And we can do a thorough evaluation to try and figure out if some of these symptoms are from a concussion, or if it's just you're having difficulties with your vision or your vestibular system.
Yeah. And then we go on to our third pathway, which is our cognitive. And this is just our brain processing information phase. So the side effects can be being easily distracted, you have difficulty concentrating, or you just have trouble doing longer or multitasks. Then we'll move on into our fourth, which is our next. So due to the trauma of the concussion, whether it is the blow, the jolt, or anything like that, it causes trauma to the neck, spine, and spinal cord. And this stress can lead to headaches, and slouching, poor posture, or even carrying heavy objects can worsen that. This way. The fifth one is anxiety and mood. And through this, you can just have an increase in worry and concern. And that can make it hard to engage in activities or be social with family and friends.
The other thing too is that trouble engaging in activities. Sometimes some people can mistake it for, oh, that's just, my grandpa. He's always just like that. He comes out a little bit and then he goes inside. And those are kind of the key things to look for too, right? Like somebody who's all of a sudden sleeping all the time or spending a lot of time inside, or, significant or drastic changes in someone's behavior can start to give you, those are early signs or early recognition signs for us to be mindful that something may have occurred. Yeah.
Yeah. And then lastly, our sixth pathway is post-traumatic migraine. So this is where we experience that headache and nausea, but also light sensitivity. And this can cause trouble with sleeping. And when sleep is disrupted, there's also a disruption to daily life. And then all six of these pathways can overlap. And that's where we get our main concussion symptoms with our balance issues and everything like that. So now we're going to look at what a post-concussion expectation should be. So recovery can take 2 to 3 weeks or maybe even longer. There's post-concussion syndrome that can be experienced, and this is just a condition that is associated with head injuries, but also second impact syndrome. And this one is really important because we want to prevent another head injury happening to an individual before the first one heals. So we want that first one to heal before anything happens. So prevention is key. And
that's also really difficult too. I mean, think about our Kupuna who might be home alone and they sustained a single fall and now they're trying to get up off the ground to call for help. You don't know how many times when you find, an elderly Kupuna on the ground, how many times they attempted to get up and how many times they may have hit their head or fallen again repeatedly. So, that's a big impact to think about too. So sometimes in our Kupuna, it's hard to separate, post-concussion syndrome from a second impact syndrome. Okay, but these are just things for us to be mindful of, right?
And then we also can have post-traumatic vertigo, and that's experiencing some dizziness or spinning. And then again, those post-concussion symptoms are very similar to the symptoms experienced with a concussion, with headaches, sleep issues, depression, memory loss, or trouble with memory, concentration, and thinking.
And when it comes to these post-concussion symptoms, going back to the one slide on the concussion pathways, when I was reviewing the slide, it had everything written up there at one time. And I actually love the slide so much because it shows how so many of these symptoms are involved with each other. You're not going to follow one particular pathway. One individual may have 5 of these symptoms. Another individual may have 20 of them. Another individual may have a single one. And that's the difficulty with concussions is, number one, recognizing that it happened. Number two, recognizing the severity of it as time goes by and trying to figure out for each single individual, what are the best treatment options and how can we mitigate these symptoms from worsening.
And the delay, we talk about a 2 to 3 week recovery time frame, but if you are not able to recognize that some of the symptoms or changes in someone is due to a concussion, right, then you're not really starting that recovery phase. So the longer you take to create an intervention to manage the concussion or to deal with the concussion or help that individual, work through this, is the more severity and intensity of the symptoms can become. They can become very debilitating.
Absolutely.
People get so dizzy that, taking Dramamine or anything of that nature is not helpful. And it really impacts us as a whole, as an individual. And so this is where, even after your your recovery and you feel like you're back to yourself again, that does not mean that you are not vulnerable to post-concussion symptoms in the future, depending on your activity. Mm-hmm.
So next, we're gonna just go through a little case study situation to better understand and realistically put into our heads what a concussion can look like. So what we have here is a 75-year-old female who has a history of being an athlete and suffering concussions in the past. Right now, she is currently attending physical therapy to get some assistance because she has had troubles with balance and has just gotten a cane. She has expressed that she is lacking confidence and is very scared of falling. She has also lost a lot of her independence because of other medical circumstances that has come up, and this has taken a toll on her mentally. She came into her next appointment with her therapist and let her therapist know that she has had a fall within the past week. She expressed that she lost her balance while walking around the house, and to try and catch herself, she tried to grab onto a chair, but unfortunately it slipped from under her. She then fell and hit her head, but fortunately her daughter was home with her to find her. Her daughter did know a little bit about concussions, so she closely monitored her, but there was no immediate or obvious symptoms that were able to be observed. But a few hours later, she told her daughter that she was starting to have a headache and felt nauseous, and that's when her daughter was able to conclude that there was most likely a concussion that was experienced. So because her daughter was able to conclude that she most likely had a concussion, she knew that for recovery, even though it does look different for everyone, that rest for the first 2 days should be done. This involves calm activities with little to no screen time, avoiding any stimulating activities, lots of rest, and no driving if driving is still something that is done. And it is also critical to avoid using any over-the-counter painkillers because this can lead to more problems, and also that recovery is all about monitoring your symptoms. If there are any changes or things become worse, please contact your physician.
So Dr. Harmeling, you want to speak on why we don't use over-the-counter painkillers?
Well, at the time that we have the traumatic brain injury, we don't know exactly what's happening inside the brain. We don't know if we have any sort of bleeding or damage that can worsen as a result of over-the-counter painkillers. So I think when they mention those, they're talking more about aspirin, Motrin, ibuprofen. Something like Tylenol would be safe to use if someone is concerned with pain, sort of mitigating that. But any other sort of medication you don't want to take. And if your pain is very, very severe, then you want to make sure that you seek out emergency attention. Sometimes someone will, one of the signs of having an intracranial bleed is the typical sign that people say, it's the worst headache of my life. Well, if it's the worst headache of your life, but you're controlling it by pounding Motrin and taking all this pain medication, you may sort of underplay those symptoms a little bit. So, for mild head bangs that kind of hurt a little bit, Tylenol is safe, nothing other than that. But if your pain is significant, if it's the worst headache you've ever had, then you want to seek emergency attention for something like that.
Yeah. Well, thank you. And, I want to go back to, resting with calm activities. We talk about cutting screen time, but a lot of time people think a calm activity is sitting down and watching TV or sitting and listening to music. We have to remember that the injury has occurred in our brain, and our brain is processing all sensory information that is coming into us, right?
Right.
So if we're watching something, then we are stimulating our brain by what we are visually seeing, and that flickering light and that changes and all of that, you know, action on an action movie you might be watching, that's not a calm activity for your brain, right? And that's why we talk about cutting screen time. Scrolling on social media is not a calm activity for your brain. Okay. Playing a video game or playing, you know, what is it, solitaire or Candy Crush on your phone, that is not a calm activity for your brain. You know, so these are things that people usually use as a regular basis, like, oh, I'm not moving around, that's, you know, I'm not doing any type of activity, I'm just sitting down. But if you're watching something, remember, it's our brain that we're trying to give a break, which means it has to not be stimulated by a bunch of visual things as much as physical activity. Okay, so we talk about calm activities. We, you know, nobody really pays attention to the fact that we shouldn't be looking at a television or a computer screen or an
Right.
iPhone, right?
And I agree with you. I think social media is probably one of the greatest challenges, because for a lot of our elderly, it is their way of communicating with family. It is their way of getting information. So almost each and every day, they may wake up and get on their iPhone. They may wake up and get on their iPad and get on Facebook, not recognizing that they are actually stimulating their brain and they're doing themselves a disservice, particularly after concussion. Well, what happens also is we fail to recognize that we have a concussion. We sort of get up off the ground and we got to shake it off and go, well, I'm okay. You know, I'm not so bad. It doesn't hurt so much. And then when we notice that our memory isn't so good or that our brain gets tired, we force ourselves through that situation. You know, we kind of just tell ourselves we need to shake it off or something else is going on. So I think that recognition in our elderly of having those concussions and what happened to your body is going to be so vastly important, particularly something like this in which we're educating people about it.
Yeah. Now we talk about lots of sleep. Okay. So when somebody does fall or somebody does sustain a concussion, like they're reaching up into the cabinet and you know, and the family soup can drops on their head as they're, you know, trying to reach from above, you
Yep.
know, it's really, really key for the first 24 hours when you know you've had, you know, some sort of head trauma, right? There might be a concussion. You know, sleep is key, but it's also dangerous if it's continuous in that first, you know, 24 hours. So depending on the severity, really, you know, we want to make sure that we're constantly waking up that individual, you know, every hour or every couple hours to make sure that they're still conscious. You know, if somebody goes to sleep and they become unconscious in the problem, they might have a brain bleed and we wouldn't know, right?
Right.
And so
Right.
it's a big deal to make sure you're just waking them up. You don't have to wake them up and get them out of bed and take them for a walk or say, you know, go eat something or go use the bathroom, you know, but just, you know, kind of waking up, being checking on them and making sure like they're okay, you know. And most times when patients sustain a fall and they break their hip, they go to the hospital, the very first thing all of my Kupuna and patients tell me is, oh, I get so mad when the nurse comes in. Every hour they're waking me up, you know, and it's like, they kind of have to, you know, we're checking to make sure you're not dead, you know. But that's the reason for that, you know, is to make sure that the brain is functioning like it should and waking you up.
Yeah.
You know, if we wake you up and all of a sudden you're slurring your speech, hey, that's a big sign for us. You know, if someone is non-responsive and you're trying to wake them up, you know, that's a big sign for us. And so the first 24 hours is real key that, you know, we're constantly kind of waking you up just to check to make sure severity of symptoms aren't bad, especially if you are sleeping, like, and you're not getting up. And that's a big change in somebody's, you know, activity level and mood. So those are things that we think about. But after we know that the brain is not sustaining a acute brain bleed, then now it's time to sleep, you know, stick yourself in a dark room, stick yourself in, you know, just calm quietness. And, you know, for someone like me who has a hard time sitting still, if it's crazy when you have to sit in a room and you just realize, you know, someone's calling and like, oh my God, I just slept for 10 hours, you know, and that has happened, you know, as someone who's experienced concussions myself, you know, you get these post-concussion symptoms and these post episodes that happen from something as little as, you know, your kid ran into you while you were lying on the ground.
Yeah.
And next thing I know, I'm down and I'm like sleeping like for the next 2 days, you know. So these are things that happen, you know, not just because you fell, not just because you got hit in the head by a ball or something. They could be from a number of things, but to understand where that's coming from, right, is key.
Yeah. And there's definitely a difference between being tired and sleeping and having altered mental status or lethargy. So what they typically recommend is keep your same sleep schedule. If you typically go to bed at 8 o'clock at night and get up at 5 o'clock in the morning, then you keep that same sleep schedule, but you allow yourself to nap and rest your brain throughout the day. Because what folks notice after concussion is they get brain fatigue. The typical activity that they would be able to complete in a very short period of time with a lot of mental clarity now takes much longer and is a little more confusing. And so it's important that you continue your activities, not so much stimulation through social media, but your regular activities that you do, but you keep your similar sleep schedule and nap throughout the day. When folks are waking you up, particularly in that first 24 to 72 hours, they're looking for that lethargy. They're looking for that altered mental status. And as long as your Kupuna can answer questions specifically, their voice is not slurred, their memory is intact, then it's okay to let them go back to sleep and continue sleeping so they can get the rest that they need. But you want to make sure that you're doing those mental status checks on them. And that's what you're looking for. The lethargy, the altered mental status, the confusion, the slurring of words, so forth and so on.
Yeah. So now that we kind of know what a concussion is, what it looks like, and what recovery can look like, now we're going to look into how we can prevent them, or at least make a home safer. So first is keeping floors clean, securing rugs so they don't lift up, watching your pets, making sure they don't walk underneath, making sure there's no cords just all over the place. Basically just eliminating any and all factors that may cause a fall. But again, a concussion is not always due to a fall. So it can be due to medications that cause dizziness and you're not fully aware of that. And you just get dizzy and things happen. But also staying active is very important because this can slow down osteoporosis, which is when the bones are weakening. But it also helps to keep our joints, ligaments, and tendons moving and working, and then also strengthening and maintaining our muscle strength. Then also having just the proper tools, the right shoes, non-slip socks, proper non-slipped things on furniture, and then even having proper canes and walkers.
Yeah, so, keeping your floors clean can be very challenging for a lot of us. Something as putting a cup on the side of the couch on the ground because we don't have an end table. Anybody can trip over that. Securing rugs really talks about our different types of surfaces in our home. So if you live in a home that has carpet in one room, tile in another, laminate flooring in another, hardwood floor in another, whenever we transition from one surface to another surface, that is a huge high risk for falls in our elderly, and even ourselves. I mean, as a mom chasing after my kids, as an angry mom chasing after my kids, sometime you can like trip on your own feet, or you're going at a certain speed and then you hit the laminate flooring and you're like, oh, and then of course now you're blaming your kid because you and lose your balance. But nevertheless, it's something to be mindful about. So a lot of people, that's why a lot of people, when Kupuna start to have difficulties moving around safely in the home, they'll change the entire flooring to all one surface, right? And we do know that tile is a very high risk for falls because if you spill something on it, it becomes very slippery. And so putting things down as non-skip taping strips, right? Like we kind of use those in the bathroom, and they have those pretty ones as heart petals or, flower petals, if you want it to be decorative. But, something so that we have that, if you're putting down a mat at the entrance of your door, or right at, coming out of your shower, but it's on a slippery surface. Okay, you know, we want to put down something non-skid underneath so that the rug is not sliding out from underneath you if you step on it in the wrong direction. So these are kind of things to think about. Most times it's better just to keep things off the floor completely as much as possible. And then we talked about wearing non-slip socks or shoes. So something like Crocs in the house, right? But Crocs too can also be dangerous because when they touch something and it's a very used Croc, we all know how local people like to use it to get pukas on the bottom. Okay, so it's super, super slippery because you lost that tread. Time to get a new pair of Crocs. Okay. Anything you want to add, Dr. Harmeling?
No, I think you said everything absolutely perfect. I love it.
So now we'll just look into the post-concussion care and really how physical therapy and even occupational therapy can help with the preventative, but also the post-care. So again, we'll just review what can be expected following a concussion, those headaches, vertigo, those mood changes due to the chemical imbalances, those issues with memory, concentration, and thinking, that increased risk of dementia, balance, and what needs to be kept in mind is the goal with recovery is to just return an individual to that pre-concussion state. So now,
So, something to think about on that. Can we go back real
Yes.
quick to that slide, Kylie? Thank you. You know, sometimes if a patient or a kupuna falls and they break their hip, everyone is so worried about the broken hip. And so it might not be until that patient is starting to do their rehab after a surgical intervention for that broken hip, where we start to notice some of these other pieces. And that's does not mean that it's too late to address the symptoms of a concussion. Okay, we can address them once we recognize them, and there's different ways for us to approach that. Okay, and so now I think Kylie's going to talk about that.
So now, how do we incorporate physical therapy and occupational therapy? So first, with physical therapy, it can help with balance issues through balance training, testing where you are at and where we can improve, but also with the neck pain that comes with it, trying to address it and treat it, managing dizziness or nausea, improving coordination and control, but also increasing our mobility. Whereas occupational therapy can really help with those sleep disturbances and but it may require some assistance from support and family members. And then occupational therapy can also help with performing tasks and improving movement patterns. And occupational therapy also can create a social environment for activities and encourage engagement. But
Yeah,
overall, physical and occupational therapy can work together to rehabilitate our kupuna back to that pre-concussion state.
So there, you know, it looks very similar as to what physical therapy and occupational therapy are, but there is a slight difference in the fact that physical therapy, we think about flexibility, mobility, activity level, and your ability to move to be able to perform functional tasks. And so where occupational therapy comes into play is they're going to now take that one step further, and they're going to help you restore your confidence and movement in doing those functional tasks. And so, you know, we talk about dressing, we talk about, you know, bathing or using the bathroom. We talk about, you know, like maybe you just wanted to play golf again, but you're too afraid to be able to keep your balance while you're walking on the green. You know, and so occupational therapy can help with a number of things. And so if we think about PT as like helping you provide that movement better, okay, and then occupational therapy, taking those movement patterns and then putting it towards a functional task that you can relate to, you know, getting in and out of bed, getting up and down from a chair, getting out of a car, you know, and there is overlap between the two disciplines, but together collaboratively is where we see the best outcomes for patients.
Yeah. You know, within my medical practice, something that I've seen numerous times is you'll have someone who's admitted to the hospital And the family is very surprised at how rapidly the decline happened to them from when the last time they saw them until now. But when you look back at the history, that elderly person has actually had a very slow decline over time. As they, instead of living within 4 rooms within their home, now they're just living within the back room or just in the kitchen. Where before they would regularly be seen traveling to visit family, now they just get on social media or they make those phone calls. So these functional declines that happen slowly over time can definitely improve with physical therapy and occupational therapy if they're recognized by the family and they're able to get the physician to make those referrals for them. But I think that it's very, very pertinent that we not wait until they are hospitalized to get these PT and OT evaluations, but even before, to prevent those hospitalizations.
Mhm. And here in Hilo, we're not really accustomed to having an occupational therapist in an outpatient setting, but now things are very different. Kino Physical Therapy does have physical and occupational therapy services here in the office, which is a big difference. We have also been doing mobility training classes. And that is huge. We've had our first summer group, right? Kylie's been helping
Yes.
run our mobility class in the morning with some of our kupuna, and it has been very interesting. And how quickly they've been able to improve their confidence and their movement. And we get this comment all the time, like, oh, I never know what the mobility is, I always thought was, I just couldn't move and I was stiff, and so it does, mobility is not the same as flexibility, where you think you got to stretch all the time. And it's not the same as strength or functional strength. Mobility is being able to move within the range that is there. Okay. And so, we tend to lose our range because we get comfortable, we get scared, and we're worried about falling, or we're worried about, creating a pain that has been coming all the time. Okay. And so mobility can definitely enhance and restore that confidence again. We have an upcoming falls and balance class, right? That's going to be starting in August. And if you're interested in that, you guys can reach out to us. But if you feel unsteady or you're not confident in walking, these are the things that we can help you with. Let's see, is it Kamana Adult Center, right? They do a bunch of activities and classes that help with balance and falls, and they have Tai Chi and all these things that you can do, and not just reaching out to Kino or another physical therapy office here in town. Okay, but there's a lot of things that we can do. What's one thing everyone doesn't really pay attention to is sensation. Okay, so how many of you can tell the difference between a sharp sensation, a dull sensation, a hot sensation, a cold sensation, or knowing 2 different points when it's being touched on your skin? Okay, these are big deals, and these are all sensory information that our body utilizes to determine whether something is happening to us that needs our attention in an emergency phase, or if it's just my kid sitting next to me or something like that. Okay, but how do we respond if we don't know what those sensory stimulus is? So I'm going to encourage everyone, and I'm sure you have something close to you right now, or somebody has long nails. If you were to touch your skin with your nail, you would expect it to be a little sharp, right? Versus touching your skin with like the pad of your finger, that should be dull. And I bet you can all going to sit there and go, what the hell is going on? How come I can't tell the difference, right? So our ability to feel a sensation without our vision to look at it is key. And that is what helps us understand our balance responses. So if we're struggling to catch our balance, we have different types of balance strategies. We have an ankle strategy, we have a knee strategy, we have a hip strategy, we have a squat strategy, we have a step strategy, and then we have a reach strategy. And if the first thing you are doing is going to a reach strategy, like I'm reaching for the wall or I'm reaching for someone to grab onto to catch my balance, that means these other 5 ones that are not so, drastic are something that your body is not responding to. So now we have to worry about your ability to interpret, discriminate different sensations, and then respond appropriately. And that's where we come into play. Okay.
And then I also had the privilege of doing a little bit of research to see how physical and occupational therapy work together. So on Kino's website, there is an article that I wrote to kind of apply and understand the use of co-therapy better. So now we just have the references for this presentation, and we would just like to thank you for your donations to the Hoʻoikaika Kino Foundation and assisting us with providing the necessary rehab services and also helping us to put together the community-centered athletic training facility. And we would just like to thank you for your time today. And if you have any questions, you can just reach out to us and also visit the website.
But before everyone goes, I'd like to maybe ask, a little bit of a discussion. I know I myself have had concussions, and Dr. Harmeling, I believe you mentioned that you have had yourself.
Oh, yes, absolutely.
Want to share a small story so that people kind of understand a little bit more in a realistic sense?
Oh, would love to. Absolutely. Well, first, before we go, I just want to say that this is a wonderful opportunity. And I think it's such an important topic to speak about, and particularly within our community. We have a higher than national average elderly population. It's about 24 to 25% of our total population. And something like concussions is very underrated in regard to the education that our elderly receive, as well as their families. And I would even say the physicians within our community. So having this topic discussed will bring us a long way forward to doing a wonderful job of taking care of our kupuna. My particular story was about 4 years ago. I love Brazilian Jiu-Jitsu, and I was in Jiu-Jitsu class, and I took an advertent knee to my left cheek, and I immediately knew that I had concussion. I described to everyone that I saw a flash of light. That flash of light was not within my vision, it was within my brain. What I came to realize later is that flash of light was actually the extent of damage of the concussion that I had gotten. Inside of your brain, you have neurons, and these neurons are connected to each other through these tentacles called dendrites. And that flash of light is when these are tearing apart because of the damage that you had. I definitely felt like my symptoms continued for 3, 6, maybe even 9 months. It was a pretty slow transition into feeling a bit normal again. Never had an episode where I couldn't work. I didn't have slurred speech. I didn't have dizziness. I didn't have a change of vision, but I definitely had changes in my mood. I definitely had brain fatigue, and I definitely felt the need to slow it down. I stayed away from caffeine. I stayed away from alcohol. I listened to slow classical music. I did as much research as I could about brain health and improving the health of my brain. So I feel like I recovered pretty well, but it was a pretty significant concussion that sort of set me on edge for quite some time. Glad to have come through it. As a physician, I definitely feel much more knowledgeable now about what concussions are and how serious they are. I'm also a volunteer AYSO soccer coach. And so each year we have to go through concussion training because soccer can have the potential of a lot of concussions. And so knowing about that and keeping my kids safe is also very important to me.
Thank you very much for sharing. So you just sustained your first concussion 4 years ago, is that right?
Oh, I'm sure as a kid and growing up, there were plenty of concussions. There were plenty of times where I fell, struck my head, got punched, something else happened. That is one that I can clearly recall that I felt that flash of light inside my brain. But just through our normal activities throughout our lives, we end up having these tiny little episodes of damage to our brain just for our normal activities. I think sometimes it's that major one that we recognize, whether we have a significant strike to our head or we lose consciousness as a result of it. But no, I'm sure that I had plenty prior to that. This was the big one, that I really recall.
Gotcha. So in my world, as a water polo player since I was 8, and I still continue to play today, I've had a number of concussions playing internationally and during my college years. And recently I was sitting in my living room on my computer in front of my television. It's the only way I can feel like I'm still a part of my family and not always working on a computer 24/7. And so it was funny, my kids and my boyfriend, they were watching, they're into this like, adventure YouTubers, right? That do these like crazy activities. And this one film that they were watching was this guy had built a log cabin completely by himself, you know, and he did a time lapse video of what it, you know, over a 2-year time frame to show start to finish, you know, in like 5 minutes, right? Because that's a YouTube video. And it was flickering super quickly. So I don't know how many of you watch horror films. So kind of like how, you know, those horror films kind of make those flashing dark and light scenes or screens. And all I did was look up from my computer, look up to the TV to see what it looked like, because we've been watching these series of episodes. And that alone set me off into a whole post-concussion series. I hadn't had a concussion that I recognized for about maybe 10 years. And it definitely came up just for me watching all of these flashing lights for just a split second. Next thing I knew, my head was pounding. I was spinning. I felt like the world around me was spinning. And then I myself was spinning in the opposite direction. I had to keep my eyes closed, and I tried to stand up to get off the chair, and I fell to the floor. And I was down for maybe about 45 minutes. I didn't lose consciousness because I could hear everybody. I could understand. I just couldn't respond to them. Like I couldn't find the words to speak to them. I couldn't say anything like, you know, and so my, you know, luckily my 2 kids are certified junior lifeguards, and because of my history with concussion, I trained them to know what to do. And so we worked through it. But now as a clinician myself, I was down for a week, and I really should not. I tried to come back to work on day 3. And after seeing one patient, I literally had to take a 2-hour nap. And that the brain fatigue that we're talking about. And so I ended up that day seeing only 2 patients. And then I was done. The next day, I couldn't even see one. And then I stayed out the rest of the weekend. But, you know, just the concussion itself, you can go back to your normal life, but you have to understand that you're going to have triggers. You're going to have these things. And sometimes in our kupuna, they cannot communicate that to us. So as family members and caretakers, you know, as community members too, to recognize that if something just doesn't look right, you know, you ask them, then maybe it's a kupuna you don't know, you know, maybe you went to somebody's graduation party, because we get a lot of those coming up, right? You know, you go and you see somebody kind of, you know, behaving a little bit awkwardly, or maybe they're, you know, stumbling, and you're like, you know, I've seen this guy before, but he don't walk like that, you know, like, you know, don't hesitate to be like, hey, you know, uncle, is everything okay? You know, you know, do you need to sit down? Do you feel lightheaded? Do you need a drink of water? A lot of times staying hydrated is a great way to help us. But yeah, I was down for 5, 6, 7 days. 5 of which I had no idea what time it was during the day. I got up, and I shouldn't have driven my kids to the bus to go to summer school. But, you know, as a single mom, we do what we got to do. And I made that decision, which was not smart at the time. And then I came home, and I had no idea I'd been asleep for 8 hours. You know, so I just want everyone to know that, you know, things can fluctuate, things can change, but if we recognize what's going on, then we have a better chance of recovering from ourselves. And as much as we want to go back to our life, as hard-headed as I am and stubborn, you know, you don't want to rush it too much, because then it just takes a lot longer and it becomes a lot more complicated. So I hope everyone can understand this from some of the stories that you've heard, and that the information was something new to you today. And we do encourage anybody to reach out. If you have questions specifically for Dr. Harmeling, you can still send them to us, and we'll be more than happy to relay them to him.
Absolutely. My pleasure.
Yeah. Okay, well, thank you everyone for clicking on this link and watching this conference, this virtual conference. Thank you, Kylie, for a great presentation. Thank you, Dr. Harmeling, for your support and contributing to the conference. And we hope that by having local providers giving this to you guys, it gives you a little bit more confidence that the clinicians and providers in the community can do and know what to do to help you. And if they cannot do it themselves, they know exactly who to send you to. Okay. And you do have a choice. You don't have to come to Kino. You can go to whomever you like. Okay. But we just want to make sure that everybody knows, you know, so that we can communicate clearly and understand what everyone needs. Okay, so thank you everyone for attending today, and we hope that you guys live your life. And if you need anything, again, don't hesitate to reach out to us.
Thank you, everyone. Have a wonderful day. Aloha.
Bye.
All right, thank you.